Meher, we can start now.
Okay, so welcome to today's webinar on an introduction to postgraduate programs at the UCL Faculty of Brain Sciences for psychology and neuroscience graduates. We are honored to have with us Dr. Julie Evans, the faculty tutor in the UCL Faculty of Brain Sciences. Dr. Evans works closely with Professor David Shanks, Deputy Dean for the faculty, and has overreaching responsibilities for education and the student experience for all students studying in the faculty. So first we'll have a session with Dr. Julie Evans, after which the students will be able to interact with them, have a QA session. And we also have student ambassadors, Aditi Janvekar, Sashwat Guha, Jay Sethi, Rishta Vora, Manjari Goyal, and Leanne Tab to answer some of the questions which can be put up by the students. So over to Dr. Julie Evans. Thank you for joining.
Thank you very much. I'd first like to ask the students to put their camera on and introduce themselves before I launch into my talk, just briefly, just to say what program they're studying and also where they're from in India. That would be great. So can I ask the students to do that, please?
Shall I start?
Yes,
Yeah.
go for it.
So I'm Shashwat Guha, and I'm a current master's student in clinical neuroscience at UCL. And I'm from Bangalore, but I'm Bengali. So it's lovely to meet you all.
Thank you very much. Next student, please, because I can't see all your pictures.
Hi, good morning.
Sorry, go ahead.
Okay. Hi, my name is Aditi and I'm doing my master's in clinical neuroscience and I'm from New Bombay.
Thank you.
Hi, my name is Jay and I'm doing the clinical mental health sciences MSc and I'm from Pune.
Thank you.
Hello, I'm Rishita Vora and I'm from Bombay and I'm currently doing the MSc in clinical neuroscience.
Thank you.
Hi, I'm Leanne. I'm currently doing the MSc Clinical Mental Health Sciences, and I'm from Mumbai.
Thank you.
Hi, I'm Manjari. I'm from Delhi, and I'm also doing the MSc Clinical Mental Health Sciences course. Nice to meet you all.
Thank you very much.
I think that's it, Julie.
That's it. Okay, lovely. So these students are here in London studying a variety of programs in psychology and neuroscience already. And they are the best people really to answer your questions at the end, up towards the end of the event today. But if I can ask that we start with my presentation now, and there'll be plenty of time for questions at the end. Thank you, students. You can turn your cameras off now. That will be brilliant.
Can I check if you can see the presentation?
I can see the presentation.
Okay, great.
Okay, so welcome to this event where hopefully we'll be able to give you lots of information about the number of programs that you can study at UCL in our faculty, specifically for some people who have a psychology or a neuroscience background. So this is the schedule. I'm going to give a short presentation. We've already introduced our current master students. As you can see, they're from all over India. And then we'll have a Q&A panel at the end of my presentation. Okay, so as has already been slightly said, I got overarching responsibility for programs and education within the faculty from the moment that you apply to the time that you graduate. So I actually sign the final form that gives you your classification for your degree, should you come to study here. So this is the sort of start and finish of my responsibility to ensure that you have the best experience and the best education possible at UCL. So I just want to say a little bit about how UCL is structured to give you a bit of a context. So education and research at UCL is organized into 11 different faculties that are related to the different subject disciplines. So for example, we have a Faculty of Life Sciences, a Faculty of Arts and Humanities, Faculty of Social and Historical Sciences, and we have the best faculty, obviously, at UCL, though I'm a bit biased, the Faculty of Brain Sciences. So Brain Sciences covers a number of different areas, and they're organized into different divisions and institutes, what you would say departments. So we have the Division of Psychology and Language Sciences, we have the Division of Psychiatry, we have the Queen Square Institute of Neurology, we have the Institute of Ophthalmology, and we also have the Ear Institute. So that covers a lot of subject areas in which we are able to offer educational programs. So just to delve a little bit more into a little bit more detail about the faculty organization, you can see that the two biggest areas in terms of research and also in terms of education provision are the Division of Psychology and Language Sciences and the Institute of Neurology. And they are further subdivided into research departments, which the programs are embedded in. So I'm not going to go into all of the details, but you can see in the Division of Psychology and Language Sciences, we cover everything from clinical educational health psychology to speech and hearing, language sciences, linguistics, cognitive neuroscience, and also human-computer interaction, as we've got the UCL Interaction Centre, which is joint with computer science. And then again, another big area of the faculty, the Queen Square Institute of Neurology, is further subdivided into different research departments, looking at different information, different kind of disorders and different types of research into neurology. So we have everything from molecular neuroscience, looking at very low-level science, neuroimaging, neuroinflammation, neurodegenerative diseases. A key one of those, of course, is dementia. Whereas the smaller areas, psychiatry, Ear Institute, and ophthalmology, are just one particular department. They don't have any subdivisions. So although the Division of Psychology and Language Sciences is the largest provider of master's programs for psychology graduates, there are also other areas that offer opportunities for psychology and also neuroscience graduates. So the Division of Psychiatry and Queen Square Institute of Neurology. And I'll talk to you about those a little bit later. And many of the programs are multidisciplinary. So neuroscience is something that covers, broad areas. And often you have students studying psychology who go on to a neuroscience program in the faculty, and also individuals who might be studying biomed science or neuroscience going on to broad-based programs like behavior change, for example. So our Division of Psychology and Language Sciences is the largest and the most highly ranked department of psychology and language sciences in the UK. And I hope to explore through the rest of the talk some of the world-leading research and teaching that goes on in those areas, particularly with regards to mental health and ill health, well-being, the mind, behavior, and language, which is such an important and unique aspect of human behavior. So I don't want to boast, but I'm just going to say a few things about UCL's global reputation, and particularly in relation to psychology and neuroscience. So For psychology, UCL is ranked first in Europe, second in the world, through various rankings. UCL currently is named University of the Year by the Times and the Sunday Times. Thank you for that, Sunday Times. And also UCL is ranked first in Europe and second in the world for neuroscience research. And obviously that has significant implications in terms of the excellent education that we provide in neuroscience related programs. We're also in the UK, the biggest, so first for research power in psychology, psychiatry, and neuroscience. And this means that we basically have more researchers doing more impactful research. So research that has an impact on, diseases, brain sciences across the world, particularly in the areas of mental health and dementia. And overall, at the moment, UCL is ranked 9th in the world. So by joining UCL, you're really joining an amazing, world-leading university, but with particular expertise in psychology and neuroscience. So as you've seen with a little journey through our departments and our institutes and divisions, brain sciences in terms of research and also teaching covers the real breadth within brain sciences. So, it covers things like behavioral and cognitive neuroscience, language, where language can go wrong, sensory systems, learning and memory, lots of therapeutic interventions, decision-making, social cognition, and these can be applied to the most significant problems that are facing the world today: mental health, inequality, social conflicts, dementia, climate change. And here's just some highlights, which you can follow the links and have a look on our webpage of the research that we're doing in 2023, and really impactful research. So, really authentic real world research that will have an impact on the understanding and the interventions in relation to really problematic and global problems such as Parkinson's disease. So, at the Institute of Ophthalmology, where I'm actually sitting today, they have done some research which has shown that eye scans can detect signs of Parkinson's disease up to 7 years before diagnosis. And of course, with any kind of neurological disorder, then the sort of golden egg, if you like, is to find those early markers before any symptoms develop, so that you're able to target intervention much earlier. If you only start to give medication or other interventions when the symptoms are present, then it's already too late to repair any damage that's been done. You can only prevent the damage from progressing. So early detection is really, really, really important in research and interventions and treating neurological disorders. Again, in psychiatry, so there's some very interesting work going on in using AI to help diagnose schizophrenia. In the Institute of Neurology. They based new tools based on AI language models that can characterize really subtle differences in the speech of patients diagnosed with schizophrenia. And again, that's about using this as an early marker, so that early intervention can really help support those individuals with schizophrenia. And then again, another neurological disorder, so Alzheimer's, which is a form of dementia, one of the most common forms of dementia. There's a world first trial at UCL and the sister hospital UCLH, looking at how effective a new genetic therapy is for Alzheimer's disease. And that's lowering levels of what we know to be a very harmful tau protein, which causes the disease of Alzheimer's and many other types of dementias. So just a little flavor of the really impactful research that is going on within the Faculty of Brain Sciences, and this kind of research, you know, will be involved in and impacting on your education in those particular areas. So I wanted to first say something about the structure of master's programs at UCL, because it may be a little bit different to structures that you're used to. So MSc programs have what is called 180 credits, and this is equivalent to a minimum of 1,800 hours of learning and self-study. That's the minimum. And it consists of 120 credits of taught courses, or modules as we call them, and a 60 credit research project or dissertation, depending upon which program that you choose. So 1,200 hours of taught courses and 600 hours minimum, though many students spend a lot more on this, on your research project or dissertation. And each of these courses, including the research project, will be graded on a percentage scale. And then we average the overall marks to give you the award classifications. So if your average is between 50 and 59%, that's a pass. So note that the pass mark for master's level programs is 50%. To achieve a merit, you need to have an average between 60 and 69%. And then to achieve a distinction, which is the highest classification, then you need to achieve an average of 70% minimum. So that might be a little bit different from the bachelor's programs that you're used to. We also offer a different kind of master's program. These are masters in research programs, which you might be unfamiliar with. I don't know if they have these in India, but these are designed for those who are pretty sure that they want to go on and study for a PhD later in life, and those who want to do a larger research project. So the purpose of you coming to take an MRes program would be to really focus very much on the research rather than the taught courses or the modules. So again, it's 180 credits, so that's representative of 1,800 learning hours minimum of partly taught, partly self-taught, or self-study. But only 60 credits of these are taught modules. So you would just take 4 15-credit modules. So 600 hours would be taught modules, and you do a much bigger research project. So that's double the size at 120 credits, 1,200 hours minimum of a research project. So that must be data-driven, not a written dissertation that is library-based. And the MRes programs are graded and classified in the same way as the MSc programs, with a minimum 50% pass mark. Now pass 50 to 59%, a merit 60 to 69%, and then the distinction 70% above as an average across all of the modules that you take. But these kinds of programs are more suitable for those who know at this point in time that they would like to do, or they're thinking about doing, a PhD, because you do a significantly larger research project, which would really help you in terms of the next step of applying for PhD programs. So, going back to the programs that we actually offer, most programs are in psychology and language sciences. And if you have a psychology or neuroscience background, then you can apply for all of these. So we offer behavior change, MSc, which is very popular, child and adolescent psychology and neuroscience in practice. That's a 2-year program that's available as MSc and a PG dip. Cognitive neuroscience, and again you have the option of taking an MSc in cognitive neuroscience or choosing the more research focused routes as an MRes option. Cognitive and decision sciences, developmental neuroscience and psychopathology. So that's a 2-year program with the 2nd year spent in Yale University. So that's a very selective program with only 12 students per year getting onto that program. But we have had some students from India on that program. Developmental psychology and clinical practice, early child development and clinical applications, and human-computer interaction. And then we have, still within this division of psychology and language sciences, we also have an MSc in language sciences where you can take a particular focus. So you could choose to take a route looking at development of language and speech, the neuroscience, sign language, technology, etc., etc. So that is an MSc program with some specialized routes depending on your particular interest, but some core modules. And then we have social cognition, research and applications, speech and language sciences, which is actually a 2-year program that basically prepares you to be a speech and language therapist. So that is a very clinical program, again, very competitive. It's a 2-year program because it has a lot of placement work as you work within the NHS speech and language therapy units to gain those clinical competencies that will enable you to become a speech and language therapist, as well as all of the theory and the research behind that. We also have a theoretical psychoanalytic studies, so that's more less clinical, more research-based, more theoretically based. And finally, we have an MSc in psychological sciences, which is actually a conversion program for those students who would like to pursue a postgraduate master's in specialized masters in psychology, but have not got a psychology background. So this gives you the equivalent in 1 year. It's a very intense year in terms of accreditation as taking an undergraduate degree in psychology. So that's really for people who want to make a career change and do not into psychology and do not have a background in psychology. So this is the necessary academic qualification that you need before you can go on to train as a specialist psychologist, which involves more postgraduate study. And then we have a number of master's programs in psychiatry. So we have the biggest program, which is clinical mental health sciences. So that's of great interest for anybody who wants to know more about clinical psychology, clinical mental health disorders, as preparation to perhaps going on to train as a clinical psychologist or work in that area. So there's also a research option. So there's mental health and sciences research, which is really aimed at psychiatrists and medics who want to learn how to do research in mental health. And then we have a dementia program, which has some overlapping modules with clinical mental health sciences, but is really focused on the psychological aspects of dementia. So causes, treatments, and research. And then we have an MRes in brain sciences. So that's, again, the more research-focused degree at master's level. And finally, we have a number of programs in the Institute of Neurology. The first one being a joint 2-year program with the Sorbonne in Paris. So the first year you spend in UCL in London. The second year you spend in Paris studying at the Sorbonne. So this is like a dual award. So you have a degree from UCL and also a degree from the Sorbonne in Paris, a very prestigious university. And that's called Brain and Mind Sciences. You do have to speak French because the second year in Paris, the lectures are taught in French. We have our big MSc Clinical Neuroscience. That's the flagship program there, which is open to those with a neuroscience and a psychology background. And then we have on the clinical neuroscience masters, we have some specialist routes if you're interested in particularly neuromuscular diseases or stroke. So these are some specialist routes that you can take along with the clinical neuroscience kind of shared modules. We also have a neuroscience MSc in dementia. So this is, again, has some overlapping modules with the dementia program that's offered in psychiatry, but also some different ones. So this takes a more neuroscience approach rather than a psychological approach. And then we have a couple of MRes programs, one looking at neuromuscular disease and one looking at a range of neurological disorders and how we translate that information and that research and that data and that knowledge that we get from the bench, if you like, the low-level basic sciences, that the research that goes on at the Institute of Neurology, into an understanding of clinical disorders. So this is a kind of bench to bedside, and it's about how you translate low-level basic science research into understanding diseases in individuals and interventions. And we have a number of broad research themes in the faculty that really do link to the degrees that we offer. So there's this very strong link between the sort of cutting edge research that we do and the development of our educational programs. And indeed, people who are doing the research are also delivering the programs. So, you can, again, I'm not going to go into any detail, but you can see some of the more recent research looking at neurodegeneration and neuroprotection. This is trying to understand the underlying processes of, what causes dementia, multiple sclerosis, stroke, and other complex neurological disorders. So we have people working on gene therapy targeting overactive brain cells, Huntington's disease, which is a movement disorder, and epilepsy. So again, this research links to the research departments that are within the Queen Square Institute of Neurology, and is linked to the division, our educational portfolio in that particular area. Another strong research strand, and one that links very closely to our educational portfolio, is mental health and therapeutic interventions. So, this is initiatives that are taking place between clinical psychology and psychiatry. And, some recent research has looked at, for example, tackling barriers to mental health and care, in terms of participation, so improving mental health research for underserved communities. Great research about talking therapy and alleviating depression and improving the quality of life for people with dementia. So that's the kind of more psychological aspect of the dementia research that we do and the educational portfolio that we have. Again, this is more about sort of prevention. So self-reflection is linked to an improved later life cognition and brain health. So self-reflection is positively associated with good cognition late in life. So that's the protective aspect, if you like, but linked to psychological techniques. So lots of very applied research going on, which you will definitely hear about on the education programs that you would study if you came here in these areas. And then another big research area, which again is linked to our educational portfolio, understanding and influencing behavior. So MSc behavior change is obviously understanding behavior and understanding how we can use principles of behavior change to change people's behavior and understanding. So many of the group that work in that area, and certainly the group leader, was working with the government during COVID because during COVID, we had to learn as a country to change our behaviours, to isolate ourselves, to wear masks, to stand, you know, with it, not to get close to people, to you know, stand within 2 meters of people. So this was a really good example of academia working with the government in a massive health promotion campaign during COVID. And some areas of research have looked at things like, what is the difference between growing up in rural or suburban areas, and how does that impact on your spatial navigation? Why are children more optimistic than adolescents? So that's another area. So lots of research going on linked to our programs in terms of understanding and influencing behavior of individuals and also groups. Okay, so moving on to entry requirements now. So all of our master's programs require in the UK system a minimum 2-1 in your undergraduate degree. So that translates into the Indian equivalent of a bachelor's degree with a minimum overall cumulative GPA of 7.75 out of 10, 6.25 out of 8, etc., or 60% where a GPA scale is not used. The overall mark required is dependent on the subject that you've studied and the ranking of the institution where you've completed your degree. Sometimes some of the programs will need you to have a degree from a relevant subject, such as psychology, sociology, neuroscience, cognitive neuroscience, biological sciences such as biochemistry or physiology or biomed sciences. So some programs will have a more open entry, some will require you to have a degree in a specific subject as well as a certain level or classification in your degree. And most programs have a minimum level 2 requirement for English language. So that's equivalent to IELTS of 7 and a minimum of 6.5 in each component. Though some programs such as speech and language sciences, where you're training to become a speech and language therapist, will have a higher requirement for English language. So there's a lot of supports for international students coming to UCL. We absolutely realise that you may not have been to the UK before. You certainly may not have studied within a UK higher education system. So it's all a bit of a shock, but there's lots of support to help you. So we have an international student support team that helps international students to settle into life in London and the UK. So very practical help, and also helps you make the most of your time at UCL and in London. London is the gateway to Europe. It's an amazing world city. So it's not just about the academic work, it's also about networking, having experiences, and the international student support team is there to help you. So there's a very good international student orientation program that you would have access to even before you arrive, but also is very much focused on supporting you in the first week before you start your lectures during induction week, where you get really practical guidance on things like healthcare, banking, transport, safety. UCL also offers pre-masters and pre-sessional English courses to help you develop your academic English if you require them. In the UK at the moment, we still have the graduate route, which is essentially is a government initiative that enables students, international students who've successfully completed a degree at undergraduate level or at postgraduate level, who have a valid Tier 4 student visa, to stay for an additional 2 years after your student visa has expired, and to be able to work. So in order to meet the requirements of the graduate route, you need to successfully completed an eligible course, which our master's programs are, at a higher education provider, UCL. So you must not have held any similar visa previously, and you must have held a student visa for at least 12 months before applying for this. So essentially, this gives you an opportunity to apply for a work visa for up to 2 years once you've graduated, and to get that really valuable experience of working in the UK before you return to your home country. And you're probably thinking, well, how am I going to get a job? So there is a fantastic careers support service at UCL that definitely will be able to help you with that. And moving on to the UCL career slide, the UCL Careers is great at a lot of things. It's about exploring occupations and job sectors. So it's career advice, not just helping you find a job. It's about finding work opportunities and volunteering vacancies that might help you to get that paid job. It will also help with writing CVs and job applications. Again, if you're coming from a different country and a different culture, there are different ways of writing CVs in the UK and different formats for job applications than perhaps they are in India, helping you with interview skills, and also offering aptitude tests to help you decide, you know, what kind of career, these are the things I like, these are my skills, this is my knowledge, what kind of jobs can I do? And there's also a dedicated job board for UCL students. So if you have the time to work during your very, very full 1-year MSc, then there is a dedicated job board for UCL students. And you can work for up to, I think it's 20 hours a week on a Tier 4 visa, but somebody can correct me about that if I've got that wrong. And there's a number of events and job fairs throughout the year which you can go to, and you can have one-to-one support in terms of your CV and job applications. So there's not just workshops that you can attend, but you can actually have individual meetings with the UCL Careers to help you with the next step of your career once you're close to finishing your master's program with us. And that's the end of my talk. So what will follow will be, we can stop sharing the screen, and then there'll be an opportunity to ask questions and for us and the students to answer them.
So we have, thank you very much, Julie, for your very informative session on the brain science, Faculty of Brain Science, and the courses that it offers. A few students have asked some questions and they've written it in the chat. I'm reading it out and I'll be happy if, you know, it can be answered. So I'm just sharing some questions one by one. Okay.
Can we just, can we stop sharing the screen for my talk?
Yes.
Thank you.
Yeah, sorry. 1 second, I'm just trying to do that now.
Thank you.
So, okay, so one question asked by the student is, does work experience play a crucial role in selection at UCL? If I marginally fall short of the requirement, can it be considered? And is work experience, is internship while doing the course, can be counted as work experience?
Okay, so I'll take that one. Though I might ask some of the other students to comment on some of the other questions. UCL is a highly competitive university. We have many more applications than we have places for in our courses. So except in really rare occasions, work experience would not compensate for you know, not having the minimum grade to be considered. So
Okay.
the answer to that is no. You need to meet the grade, essentially.
Okay. So grade is prime and
Grade
work
is
experience
prime.
is yeah.
Yeah.
Thank you. Thank you very much.
But,
I have another...
having said that, if you have, as I said, UCL is so competitive that although we don't expect you to have relevant work experience, if you have had relevant work experience, and that can be volunteer experience as well, particularly if you're applying for some of the more clinical courses, then that will help you to be more competitive, even if you've met the grade required, okay? Because, you know, we have hundreds of applications of people who have not just met the minimum grade requirement, but actually have exceeded that. So if you've got something extra that you can add, but it has to be relevant, then, you know, in terms of volunteer or work experience, then that's really going to help, or that you mention it in your application. And I'm going to ask did any of the students around here on the panel did they have any relevant volunteer or work experience that they discussed in their applications? Any of you want to come on and comment? Yeah. Can't hear you at the moment.
Am I audible?
Paid work
No.
experience, but I did shadow a researcher at
Okay, that we've got really bad sound there, so maybe we'll come back to you. Does someone else want to come on? Leanne?
So, I don't know about work experience, but I think even internships in the setting you kind of want to work in, and if you have clarity about what you'd like to do, I think that always helps in your applications. Even if it's shadowing someone or volunteering at organization, I think those kind of experiences do help in writing your applications.
Thank you, Leanne. I mean, it's got to be relevant though, yeah? So it's not just any internship or any volunteer work. It's got to be relevant to the core areas of the degree that you're applying for. Shashwat. Oh.
Yeah, so I kind of echo what Leanne said. So me personally, I did an undergraduate degree in biological sciences. So when I did my master's in neuroscience, it was a transition because I didn't know much about neuroscience. But I did do an internship looking at ADHD patients. So that was something I included in my application. And I suspect that's what, helped me get selected and gain admission at UCL. So I would say, yeah, relevant work experience, any kind of internship, over the summer or anything like that definitely helps.
Thank you. Jay?
I haven't.
Oh.
Hi, should I come in?
If it's answering this question, yes.
Yeah, thank you. So I was actually gonna say that I did have relevant internship experience, not exactly like, a job per se, but I did work part-time with two psychologists, and I was kind of maintaining their schedules, emailing clients, kind of just making sure the appointments and everything are good to go, and also managing the case sheets, just minor stuff like your demographic information, your case history, etc. So that experience, I elaborated on it, and I feel like that really helped me get into the course.
Thank you. I hope that's been helpful. So Mehan, next question maybe?
Yeah, I have a question again from a student. I have completed my bachelor's study in the field of computer science with a CGPA of 8.6. I am working under a fellowship for Teach for India for past 2 years, working on child development and teaching underprivileged students. I am keen to join Early Child Development and Clinical Applications MSc. Will I be eligible?
That's a good question. And Colin, maybe you could quickly look up whether certainly the work experience is interesting, possibly relevant, but of course it's a completely different degree program. And that Colin is now looking up what the program entry requirements are. It may be that if it requires a psychology degree first of all, then even with the work experience, this wouldn't be sufficient, because they won't have studied they won't have studied psychology previously, and as a master's course, it will rely on on successful applicants having a certain knowledge about some of the the core areas of psychology. It may be that that individual would need to take that MSc in psychological sciences, the conversion course that I talked about first, before they're able to get on to or be in a position where they can apply for the early child development, because that does presume some previous knowledge of psychology in that area. Remember, we said that some degrees will require you to have, some master's programs are interdisciplinary, but some will require you to have a specific knowledge or studied a specific degree first at undergraduate level. Colin, did you manage to look that up quickly?
Yeah, I did. Thanks, Judy. So apparently the program doesn't specify the subject of your undergraduate degree. So potentially, even if you do come from a computer science undergraduate background, if you have the relevant work experience on the program, I think that would definitely, or for the program, I think that would definitely help with your application. I think as Judy noted as well, I think some of the challenges kind of balancing the other applications that program will be receiving. So that program will be receiving applications from people that have studied psychology at the undergraduate level, and then perhaps also have work experience. But from the looks of it, you would be eligible to apply for it as long as you have an upper second class qualification in your undergraduate degree, so a 2-1 or above. But I think from the sounds of things, it does sound like the work experience that you have is very applicable to the course. There is actually a website, an email address on the UCL website, and I'd perhaps recommend emailing that email address just to check about your eligibility for the course, and they would be able to get back to you and help advise you whether they think you would be suitable for the course, but also to make sure that you get the most out of the course as well.
Thank you, Colin, for clarifying that. We have so many postgraduate programs in brain sciences. I didn't immediately know what the entry criterion was. So thank you, Colin.
That was helpful. Okay, I have another question. There is a student asking that he has done a law bachelor's, worked for law, but now wants to do a psychology conversion course, wants to know what are the job prospects or what are the prospects after doing this. Since he doesn't have a background in psychology, wants to do a psychology conversion course, so wants to know what are the prospects after doing that.
Okay, so undertaking the MSc Psychological Sciences conversion course is the first step. You won't be, you will be in the same position in terms of our professional body, British Psychological Society, as someone who's taken an undergraduate degree. So it doesn't directly qualify you to be a psychologist. Okay, there's a whole other process for that. What it does give you is an academic qualification and an accreditation that enables you to apply for other postgraduate programs, which would qualify you eventually as a psychologist, not just at UCL, but other places as well. So you would have to do a minimum 2 to 3 years extra on study on top of the MSc Psychological Sciences, the conversion program, before you could actually call yourself, you would have the qualification chartered psychologist. So these can be in a number of different areas. There's clinical and educational psychology that we offer at UCL. So those are 3-year programs, but at the end of that program, then you do have, the qualification to practice in the UK as a clinical or an educational health psychologist. Of course, you have the issue there because if you've been on a student visa, you can then apply for a 2-year work visa to work as a psychologist, a chartered psychologist in the UK. But after that, you have the issue that everybody has. You don't have the right to work after that the post-study work visa. So that's the issue. And there are other areas of psychology that offer training programs in things like sports psychology, occupational psychology, forensic psychology, counseling psychology. So we don't offer those at UCL, but many other universities do. What I'd recommend that student do is have a look at the British Psychological Society website, and I'll put it in the chat what the link is, and that explains all of the different professional areas of psychology that you can train in, and it explains what the training route is. But for a career in psychology, if they want to pursue that, the first step is getting this conversion program and successfully passing that before they can go anywhere else. So let me just put in the chat, which everyone will have access to, what the website is for the British Psychological Society. I'll do that now.
And for anyone who's watching on the live stream, the web address is bps.org.uk. So if you search for bps.org.uk, then that will send you to the British Psychological Society website, and they have a lot of information about the career path that you need to follow for to become a chartered psychologist.
Yes, 6. Thank you very much for the update. Thank you. So the next question is from a student. He writes, I'm interested to apply for human-computer interaction program, but my bachelor study has been in architecture. I am familiar with user experience design, taken online certifications. Can I apply for this course, the human-computer interaction?
Again, I think that has specific entry requirements, because they are assuming a certain knowledge and expertise in computer science. So they're, I think, unlikely from the current degree in architecture. But I would recommend that you contact the program, and on the prospectus there is an email for inquiries, because they might be able to recommend specific courses that you could take that might enhance your application. But they presume a certain level of knowledge about computer science and programming, etc. So from architecture, that's a really big step without some intervening courses that you would have to take. But the best place to ask is of the course itself, and so follow the email on the website for the inquiries about that program.
Okay, thank you very much. Thank you very much. Another question from a student. I'm coming for Bachelor's of Arts background with psychology majors. Can I apply for a clinical mental health science program?
The answer to that is yes. I guess it depends slightly on how major that major is, what percentage of psychology modules they would have studied when they're studying a major. Is it 50%? Is it 60%? But I think it would be helpful to maybe bring the clinical mental health sciences students to help answer that as well. So students from clinical mental health sciences, do you want to pop your cameras on and answer that? So we have Dala. Dala, do you want to say something?
I did do my psychology majors in my Bachelor's of Arts, and I'm on the clinical mental health sciences course. So I guess it is possible. I did mine at University of Mumbai. So Jai Hind College, if anyone wants to know. Yeah.
Thank you very much.
Thank you. Thank you very much.
Jay, what about you?
I'm not, so since they said major, I think mine wouldn't be applicable, because I did an honors course. I did a BA psychology honors. So I think that's a little more in depth. So yeah, I think Leanne's POV is more apt here.
Yeah, and I think as well, thank you, Jay. Anyway, I think as well, it depends on what courses you've taken. So they'd be looking for courses in things like research methods, individual differences, social psychology, personality, and maybe something that you studied in the area of clinical psychology, abnormal psychology, psychological disorders. So yes, definitely eligible to apply, but without knowing the details of how much psychology you've studied, what percentage and what courses that you've studied, I couldn't give you a definitive answer, but certainly worth applying.
Okay.
Hope
Yeah,
that
we
helps.
already have students with a background like that, right? Another question from an ophthalmology student
Okay.
wants to know, a medic student wants to know how much of clinical involvement will be there in this course. Will I be able to look at patients, handle patients? So that's the question for ophthalmology.
Okay, so I can answer that. I'm sitting in the Institute of Ophthalmology at the moment. Okay, so this is a master's course which will be delivered almost entirely by ophthalmologists who are working at Moorfields Eye Hospital. The program leaders, all of the module leaders are clinical people who are also clinical academics and do research. So that's the first thing. So it's very clinically oriented and is very relevant for those who wish to pursue a career in ophthalmology, so specialize in that area. The link between that and on the ground observerships or sitting in clinics with patients is a little bit more challenging, and that's not guaranteed in terms of access to patients. And that's because of ethical considerations. So, these are patients. There are protective kind of ethical and legal considerations. Although medical students, when they're doing their MBBS, obviously that clinical placement is part of their training, but this is a postgraduate qualification, and it's not, the clinical placements are not part of the course. Having said that, it stopped during COVID, and I think it's come back now, but before COVID, separately, students on the MSc ophthalmology were able to apply through a separate system. This is not part of the course, okay? They could apply to Moorfields Eye Hospital for what is called observerships. So there were some limited observership opportunities with patients in Moorfields Eye Hospital, but that is not part of the program. That is something that students can apply as an individual separately. And we stopped that during COVID for obvious reasons, because nobody was allowed in hospital. What I would say, however, is very much part of the course is case study discussions that have come from patients that have been at Moorfields Eye Hospital. It's the best eye hospital in Europe, one of the best in the world. And one of the things that they deal with in the UK and Europe is these really, really rare eye diseases and eye conditions. So certainly the program, in terms of clinical case studies, which they will do a lot of, will be able to use these case studies from patients that have been at Moorfields that are very rare, that many ophthalmologists would never encounter in their life. But because we're such as the link between the Institute of Ophthalmology and Moorfields Eye Hospital, particularly for this program where they're all clinical academics, they will get to hear and discuss case studies, patients that you would never see normally in your lifetime in a hospital. So you've got that benefit as well. I hope that answers the question.
Yeah, very good there. Thank you so much. Thank you so much. So do we have more questions? Just a second. Ruchi, do we have more questions?
I think just whilst we're checking, if it would be okay if I could just ask some of the student ambassadors a couple of wider questions as well, just about studying at UCL. I'll try and go through this, but Manjri, just because you've turned on your camera first, if you wouldn't mind just giving a brief overview in terms of what it's been like starting at UCL. How have you found it? What's been your favorite thing about being a student at UCL so far? Because I think today or this week is the last week of term one. So hopefully you've had a good time so far. Hopefully not being too cold. But if you wouldn't mind just talking about your experience so far, that I think would be really helpful to bring to life what it's like being a student at UCL.
Yes, absolutely. So I would say my experience at UCL has been, if I had to sum it up in one word, I would say very conducive. So that means that there's been a lot of support from UCL. It was honestly very unexpected because I did my undergrad too in psychology, and I was not used to this level of support. So, and I also like a side note for anyone, because when you come here, you look at everything holistically. I also live in UCL halls, and that has also been a very good decision on my part because there's so much support. I feel so safe. It's so close to campus, so I save money on traveling expenses. And specifically about the course, the faculty is really great, very helpful. The lectures, I would not say the workload is that much. I think that's not something anybody asked her, but I do think people will worry about that. So don't worry, the workload isn't that much. Even if you have a lot of papers in a particular term, you can manage the workload very easily. You have placement opportunities as well if you join the clinical mental health sciences course. So that's also there from a career perspective. But overall, I would say it's been really great. You get a lot of opportunities to join clubs, societies. So it's a very holistic experience. So you don't just, like there's no all work, no play. There's a great balance, and it's a very conducive environment. So that's what I would like to say.
Thank you, Manjari. That's really great to hear. And yes, clinical mental health sciences does have as part of the program, but it's not assessed. But every student has the opportunity to take part as a volunteer in a work placement. Where is your work? Perhaps I'll get all of the students to say where that is if you're interested in clinical mental health sciences. So have you got your placement fixed up yet, Manjari?
Yes, so they offer two types of opportunities here, research placements and clinical placements. So I was assigned a research placement in a project that's been undertaken by the department about eating disorders. So there's a lot of opportunities here in terms of research, and I have a few friends who are doing clinical placements. So they got placed in various NHS trusts or NGOs, like non-government organizations, clinics, and etc. So there's like a variety of opportunities that are available, and most of them started in October. So again, you get the process is very smooth and very, like, I would say, methodical. So you don't have to worry about that too, that you have to run around with paperwork and everything. It's all sorted out for you.
Thank you, Manjari. And just to emphasize, this is not a formal assessed part of the course. This is just an additional thing that we do for students to get some relevant experience to help them on the next step as well as to broaden. Yes, go on.
Right. I would also like to reiterate that this is completely voluntary. This is not part of, you don't have, again, as you said, it's not assessed, and you don't need to do it as well. If you don't want to, you don't have to at all. So it's not assessed and it's not compulsory at all.
But I imagine most students take up this opportunity because it's such a great opportunity, and they're very high quality placements as well. You're not doing the filing, or photocopying or whatever. So next up on my screen, just what I could see is Shashwat, could you say something about your course?
Yeah, sure.
Manjari, if you could,
I'm doing
brilliant.
clinical neuroscience. So, I mean, we have research projects that we have to do as masters, and they are usually divided into laboratory based. So if you come from a molecular biology background, and if you come from a clinical background or a psychology background, you can do clinical trial research projects. So that involves patient contact, looking at patient data. So I think the student had previously asked, like, do you have patient contact? So the answer would be, if you pick those kind of research projects, and if you get selected for it, then yeah, you will get to collect data from patients, and so on. But of course, it's first come, first serve, because you only have so many projects and so many students. So you do have to really show your interest, make sure you talk to your supervisor, reach out. But yeah, my experience with the course has been great because I transitioned. Initially, I was apprehensive about how I would be able to cope with the workload, but because the lectures were just so comprehensive, they explain everything. It's broad and in depth at the same times, and they cover a lot of stuff. So I found it really great, and I was able to adapt it easily. So, yeah.
Excellent. Thank you very much. So maybe Leanne next.
So I'm on the clinical mental health sciences course, and I'd say it's very hectic, but it can be as relaxed or hectic as you want it to be. So you do have the option of auditing courses, taking extra modules. Um, Auditing courses is where you can attend lectures and do the coursework, but you don't have to give the exams or submit any of the assignments. So I think that's an interesting way to broaden your knowledge base. Um, my placement is at an NHS hospital, and I work with trauma informed development. Um, it's very interesting. I think got it it's a nice way to expose yourself to the UK system and how it works. Um, as for the course, the faculty and the professors are just really helpful. Like they go out of their way to help you. I'd say that there's a nice community feeling about the course itself, but it can be very hectic. There's a lot of group work involved, which some people like, some people don't like. But um, I think the way it's assessed, is very nice, and the structure of our modules is very interesting because you have people who are currently researching the field come and teach you about their research, and we have a component called lived experience where you have people who have been through the disorder you're studying about and will come and tell you their personal experiences, which I think is the best part of the course so far. And yeah, that's about it. If anyone has any
Thank you
questions.
very much. Thank you very much. Ashmita, are you there?
Oh, sorry, sorry, Judy. Ashmita and Ahmed, they're from the UCL team.
Oh, right. Sorry, I forgot that. Yeah. So, Rishita.
Yes. Hi, I'm from MSc Clinical Neuroscience, just like Shashwat. And I too come from a different background from, like, I'm not from a neuroscience background. I actually come from a psychology background back from Bombay. But since my course had a very holistic approach at psychology, so it covered all the aspects of psychology, which is why I was able to get into neuroscience. To say it was a change, yes, because it went from going a bit theoretical to clinical, but the course overall has been really great. And as Shashwat said, that you really need to be in contact with your supervisors. It's a great opportunity you have to explore. And as Dr. Julie also said, we do get to do shadow experiences. So I had the opportunity to reach out to one of my lecturers and ask for a observership at the clinic, and I was able to get one. But I'm currently going through the DBS procedure. That's the security check required for all the international students who are coming in. So that's going on, and so yeah, I'm looking forward to it, and even my dissertation. Thank you.
Thank you very much. Meha, do we have any more questions?
No, not at the moment. I can't see. So I think that was very useful and very informative. I'm sure it must have helped the students, right from the faculty to the students. And thank you very much for this.
Okay, so
Oh,
sorry.
just before we wrap, I just wondered if we wanted to hear from AJ and Jay as well, just the last
Yes,
two
please.
students.
Yeah.
Okay.
Jay, would you like to go first?
Yeah, hi. So again, I'm on the MSc Clinical Mental Health Sciences course, and I really agree with what Leanne and Manjari have said. Um, yeah, I think the course is it's really hectic. It can be really hectic if, you know, you're procrastinating. So I would say don't do that. Yeah, just try to keep going to classes. The one thing that's really good about the course is how there's like a really good community feeling. I mean, everyone's so helpful and everyone's just there to be with you and help you because as international students, it does get difficult when you first come here. It's a lot to deal with, it's a lot to cope with. So yeah, having a good network, trying to build a good network, I would really suggest that. And the people on the course are so smart and they're just really fun. The professors, the faculty, they are really considerate. In fact, I applied for through the Student Disability Services. And I can definitely say that if you are coming in with a disability, um, you know, you can reach out, seek help. Everything is very structured, um, and they're really helpful. And I also am on a clinical placement with the Camden and Islington NHS. Um, and I'm supposed to be working in the clozapine clinic. I'm still going through the DBS checks right now. But all in all, I would really say that the course is very, very good. You get what you expect, honestly. It's right up there. Yeah.
Thank you very much. And we did have another student who did have problems with their sound earlier. So AJ, are you there?
Hi, can you hear me?
Yes, we can. We can. Great.
Okay, perfect.
Excellent.
Sorry about that. My internet just crashed before. On a more general term, I would say it is very easy to find people, make friends at UCL because of the freshers fair and everything you have going on in the first couple of weeks. Even if you're an introvert, you can definitely find people who share the same interests, want to join the same committees as you. So it is absolutely lovely. Um, as Jay mentioned before, even with the disability service, I contacted them as well. Everything was so streamlined and worked out so perfectly. They were very helpful. They made sure to ask if I'm getting help, if I need any more help. So that was very nice of them. Um, Regarding the course, as Shashwat mentioned, this is a very funny way to describe it, but it's very broad and in-depth at the same time. So we have a lot of different modules that we study that give you a very wholesome understanding of neuroscience, of all the neurodegenerative diseases we're having. At the same time, when you attend the lectures, you get like in-depth knowledge of every single one of them. So that is very nice. At the same time, I would say lectures go on for about just 5 months. So it is very put together, like at the same time. So it does get hectic, but obviously attend your lectures, don't procrastinate, and always have study groups. I would say that is such an important thing to have like study sessions every week or make study groups so you all stay on track and you're always like looking after each other, which is very, very helpful. But yeah, there's so many opportunities, so many things to do, so it's never a dull day and you're always on your toes, which is absolutely lovely. Thank you.
Thank you very much, AJ. I'm glad we were able to hear from you eventually and you managed to get your broadband sorted out. Shashwat, do you have your hand up?
Yeah, I just wanted to share a quick opportunity for Indian applicants. So I think UCL is offering like a excellent scholarship for postgraduate taught students, which covers part of the fees. So I feel like that would be helpful for applicants.
Thank
So
you
yeah.
very much for mentioning that. Yes, I think UCL has just announced that quite recently, haven't they? So I think there's a number of scholarships each year. So I think UCL is kind of affirming their relationship with India, and we'd like to have more students from India. And by announcing scholarships, the sort of partial fee waiver, then hopefully that will attract more excellent students from India, such as the ones we have here, which is great. Okay, so are there any more questions that anyone has posed, or are we at the end?
Let me check.
Thank you, Meha.
Leanne, do you
Ruchi,
want...
can you confirm? Yes, Colin. Sorry, Colin. You can go on. Yeah.
Oh, no, sorry. Just whilst we check for the questions, Leanne, would you like to add something as well?
So just one thing, the clinical mental health sciences course is still extremely research focused. So I think to any students who are thinking that this is a clinical course, just go through the criteria and the information mentioned on the course to understand properly what you're going to do, because it is a very research focused course. And I think having a clear idea of what you're interested in within research is a good move before you start the course.
Thank you. Wise words indeed. And I think everyone has mentioned, all of the students have mentioned kind of not procrastinating. So this is studying master's level in the UK and particularly at UCL is very intense. And I think you need to keep up with your reading, getting lots of nods from the students, and, you know, start preparing as soon as you can for your assessments. You will know when your assessments are at the beginning of the year. You know, we tell you plenty of time in advance so you can prepare for them. So organization and management is a really important thing here. Now, depending on your course, most, though not all, of the teaching will take place in the first 2 terms. So some courses like clinical mental health sciences actually have some teaching in the 3rd term, which is kind of after the Easter break, but a lot of them don't have. But what you will be doing, and you'll start this in the 2nd term, and this will go through into the 3rd term and also through part of the summer, is your research project. And how your research project is assessed is definitely by a big written piece of work, but some of the programs that you might apply to also have additional stuff. For example, in clinical mental health sciences, they also write a blog for public consumption, okay, so for the public about their research, and they also have to give a presentation. So lots of skills that are being developed and assessed there. But you know, organization and management, and, you know, not procrastinating, not saying, oh, I'll put off that reading, I'll put off starting that assessment, is really important. So, you know, there's advantages to coming to the UK and doing a 1-year master's. In that it's 1 year, not 2, and many other countries have 2-year masters, but it's much more intense to study in the UK. So you get it done in a year, but it's quite full on, as I'm sure all of our students would say. So you haven't got time to kind of, you know, go, oh, well, I think I'll just put that off until. You need to be on it all the time. And of course, if you know, if you're doing any volunteer work or any paid work or any internship as part of your program, then you have to factor that in as well. Plus, as someone said, can't remember which student it was, maybe it was Jay, you know, it's not all work and study. It's about, you know, a richness of experience, enjoying the capital, enjoying all the other opportunities and the clubs and societies that you can join as well. So you have to take a break sometimes. So, okay, so I think we're in the last few minutes. So there's one more opportunity to post any questions. So Meha, just do a last check.
Okay. Ruchi, can you please confirm? Ruchi and Shruti, can you please confirm if we have questions? But may I ask a question? I have a question, so I can ask. I wanted to know about the BPS accreditation. Some of the courses required a BPS accredited course, right? So is it required that the student should have that accreditation before coming to UCL?
Okay, there's 2 ways that, so if a course says you have to have the BPS accreditation before you start the course, then you have to have it. There's
Okay.
2 ways that you can get, if you're an international student, there's 2 ways that you can get this. Firstly is doing the psychology conversion course, the MSc Psychological Sciences. So that's a 1-year master's full-time. And that when you complete that, you will have BPS accreditation. The other way is to apply directly to the British Psychological Society. to see if the course that you have studied meets their eligibility requirements. Now, most international students, this is not the case because because of the difference essentially in the what is studied in a psychology degree program in the UK and compared to overseas. So most overseas degree programs in psychology, and I'm not just saying India, I'm saying, you know, the States, Canada, everywhere. It's not 100% psychology. Okay, they have more kind of major minor type thing. And so it may be that even if you're taking a major in psychology, compared to an undergraduate degree in psychology that is accredited, you haven't studied sufficient psychology, and you haven't covered some areas of psychology as well, because the undergraduate degrees that are accredited in the UK have a very specific syllabus. So you have to have covered a certain range of topics, and you have to have covered them in depth. I mean, I take our psychology degree program, okay, of all of the modules across the 3 years that people study, only one of those modules is not in psychology. That's across the whole of the 3 years. They get one optional module to take, one option to take a course outside of psychology. And that is it. So kind of 95% or something ridiculous of their degree is in psychology modules, covering all of what we call the core areas of psychology, or what the BPS said. So that's research methods, in-depth and statistical analysis, social psychology, individual differences, so personality, etc., intelligence, developmental psychology, biological psychology, and cognitive psychology. So if your degree from outside the UK has not studied sufficient amount of psychology or those core areas, it's unlikely that they will give you accreditation. But you can always apply. There is an application process to see whether your degree could be accredited by them. If not, then you need to take the 1-year MSc in Psychological Sciences, that's the conversion program, to get that BPS accreditation. But you must have it before you start any course that requires it. Hope that answers your question, Meha.
Yes, thank you very much. And I have something from the student, I guess. She's written that, Leanne, can you repeat what you've written in the chat?
So I didn't need to get my course accredited for my UCL application. However, for other colleges, when I did apply, they needed accreditation. So I did the process, and I was studying at Jai Hind, and I did psychology as my major in the 3rd year, and I did get the course accredited. So I did get the BPS accreditation. Yeah.
Great. One very good example of a process. So Jay, you also had your hand up.
Yeah, so I mean, I didn't need a BPS accreditation for this course, but I did apply for it anyway. And I got accredited. I haven't exactly paid the membership fee that, you know, comes with the next step, but there's just there's a, I think, £30 or £40 of application fee, and you can check if your course is accepted by the British Psychological Society. So yeah, that's it.
Great, thank you. So 2 examples there that have used the process of checking whether your degree does meet their accreditation requirements, and both have been successful. So clearly, a psychology major in India, it is much more relevant to the UK degrees than some of the degrees from the States, where you can have a major in psychology, but like only 50% of your modules are taken in psychology. So it's about, you know, not just the amount of psychology, but also the core areas that you've covered. So thank you, Leanne and Jay, for sharing that information with us. So I think we now at the end of the webinar. So Meha, can I hand over to you to complete this?
Okay, so thank you very much for your time and for this informative session. And I'm sure the students must have benefited from all the answers and all the sessions that we came to know about the courses and the research going on in all the sections, especially in the ophthalmology that you mentioned about. So I thank you very much for this session. Thank you, Colin, for the arranging the whole thing. So thank you very much.
Oh no, thank you, everyone, and thank you. Obviously, thank you to Dr. Julie Evans, and thank you to the SIUK team. Thank you to everyone who's joined us from India, and a huge thank you to all of our
Wonderful students. Yes, who are
Great.
here. So it's a sunny day in London. What you can see behind me is actually sunny light, but it's unusual in winter. So I hope you enjoy the rest of the day. Obviously in India, it's a bit later, but it's lunchtime here, and I think we're all going to go off and get some lunch now. But we hope it's really been beneficial. Thank you to everyone for attending and taking part. So bye-bye, everybody.
Bye. Bye. Take care. Have a good week ahead.
Bye.
Bye.
Thank you. Bye.
Bye.